Psoriasis is a chronic inflammatory skin disease that affects about 1 in 40 people, making it one of the most frequent chronic skin diseases worldwide. There's lots of drugs for it, some of which cost more than $100,000 a year to get a response. There are cheaper drugs like cyclosporin, but they carry the long-term risk of kidney damage, hypertension, and malignancies. The drug can cause cancer, kidney toxicity in more than 50% of the patients treated long-term, and in terms of malignancies, up to 42 times the rate of cancer. And it doesn't even work that well, keeping the disease at bay in little more than half of patients over a 4-month period. There's got to be a better way. What about plants, topical botanical agents for the treatment of psoriasis? Well, aloe vera gel is said to possess anti-inflammatory, anti-itching, and wound-healing properties. Yeah, but as I described before, when it was put to the test for wound healing, it actually made things worse. The exploitation of aloe preparations has been accompanied too often by misinformation and exaggerated claims, but there is some impressive evidence. For example, to test its anti-inflammatory properties, it was tested head-to-head against steroids for mustard gas exposure. Mustard gas is probably the most popular chemical warfare agent, starting in World War I. The last widespread military use was in the 80s during the Iran-Iraq War, with more than 100,000 exposed, and many still suffering from the long-term complications, predominantly itching. Even decades after surviving a gas attack, 70 to 90% are still suffering. Topical steroids are the most frequently administered medications, and they help, but long-term use is not recommended and associated with a variety of side effects. Therefore, how about safer agents like aloe vera? 67 chemical warfare injured vets were randomized to apply aloe vera olive oil cream or the steroids, and the aloe vera mixture appeared to work as well as the drug. OK, well then let's give it a try for the management of psoriasis. By the end of the month-long study, the aloe vera cream had cured 83% of the patients, compared to the placebo cure rate of less than 10%, resulting in significant clearance of the psoriatic plaque skin lesions. All right, but that's compared to an inactive placebo. How about compared to steroids? Aloe was found to be more effective in reducing the clinical symptoms, like taking this nasty belly button and clearing the itchy, scaly rash away. Here's another beautiful sequence of before and after pictures, but in this case, this may have very well been the placebo treatment. In this double-blind, placebo-controlled study of a commercial aloe vera gel in the treatment of slight to moderate psoriasis, things got better in 70% of the aloe-treated sites, but 80% of the placebo-treated areas improved. The placebo beat out the aloe. The high response rate of the placebo gel indicated a possible effect in its own right. The placebo was just basically xanthan gum and water, and they were like, hey, instead of aloe failing, maybe xanthan gum just works too? All in all, the results on the effectiveness of aloe vera for psoriasis are contradictory, but applying it on the skin appears safe, so I figure, why not give it a try? Dietary supplements are commonly given to children with autism. Do they do any good? One of the most common is omega-3 fats in the form of fish oil, based on studies like this that showed a marked reduction in omega-3 blood levels among autistic children. But maybe that's reverse causation. Instead of the low omega-3s leading to autism, maybe the autism led to low omega-3s. Maybe autistic children are just pickier eaters and not eating as much fish or flax seeds. You don't know until you put it to the test. 6 months of 200 milligrams a day of DHA, one of the long-chain omega-3s, and no effect. So here all these kids are taking it despite the lack of evidence that it actually does any good. Maybe they just didn't give enough? OK, how about a randomized, placebo-controlled trial of 1,500 milligrams of long-chain omega-3s, and A high dose didn't work either. Put all the studies together, and omega-3 supplementation simply does not appear to affect autism. Here's a preliminary trial that was published of vitamin C supplements for autism that suggested benefit in at least some kids, but should not be interpreted as a blanket recommendation for vitamin C supplementation, especially at the whopping dose they used, which could increase the risk of kidney stones. Bottom line, read a 2017 review in the Journal of the Academy of Pediatrics, there's little evidence to support the use of nutritional supplements for children with autism, though they didn't review the vitamin D data. The vitamin D story started out, like the omega-3 story, clear evidence that vitamin D blood levels were significantly lower in children with autism compared to other kids, and lower D levels correlated with greater autism severity, but vitamin D is the sunshine vitamin. Rather than vitamin D playing some role in autism, isn't it more likely that autistic kids just aren't out sunbathing as much? There were some promising case reports, though. For example, this 2-year-old with autism deficient in D, whose autism seemed to improve after vitamin D supplementation. But you don't know if it's a fluke until you put it to the test. A study on the efficacy of vitamin D supplementation in 83 autistic children, and 80% got better in terms of their behavior, eye contact, attention span, concluding vitamin D is inexpensive, readily available, safe, and may have beneficial effects. But this was an open-label trial, meaning no placebo control group, so we don't know how much of the improvement was just the placebo effect. Now, sometimes open-label experiments are unavoidable. Like if you're studying the effects of physical therapy or something, it's hard to come up with like a placebo massage. But you can stick vitamin D in a pill. Why not then do a proper, randomized, double-blind, placebo-controlled trial? The typical excuse you get is that it wouldn't be ethical. I mean, if you have a kid who is vitamin D deficient, how could you just stand by and give them a sugar pill? Yeah, but if vitamin D actually works, how many kids are you condemning to continue to suffer unnecessarily by publishing a less-than-ideal study design? There are a bunch of various tenable mechanisms by which vitamin D could potentially help in children with autism: improvement in DNA repair, anti-inflammatory actions, mitochondrial protection, etc. That's why randomized controlled trials are urgently needed, but there haven't been any such studies until now. A randomized controlled trial of vitamin D supplementation in children with autism, and it's about time. They gave kids up to 5,000 international units a day, depending on their weight, versus a placebo. The drugs we have for autism really just help with some of the associated symptoms, like we can give kids sleeping pills or something, but there's no drug that really touches the core symptoms of autism. So research groups around the world are looking for something better, and this group appeared to find it. Vitamin D supplementation revealed significant effects on the core manifestations of autism spectrum disorder. Significant improvements in not only irritability and hyperactivity, but social withdrawal and repetitive behaviors and inappropriate speech, the first double-blind, randomized controlled trial proving the efficacy of vitamin D in autism patients. Only about 1 in 4 people have heard of Campylobacter, compared to 90% familiar with Salmonella. Although the incidence of these two gastrointestinal infections is amazingly high, infecting more than 1 million Americans every year, it is outranked by the incidence of a bug even fewer people have likely heard of, XPEC. Extraintestinal, meaning outside of the intestines, like as in causing bladder infections; pathogenic, meaning disease-causing, E. coli, resulting in millions of infections annually. Multiple lines of evidence indicate poultry may be a major food animal reservoir for bacteria that cause urinary tract infections in people, as I explored about 5 years ago. This is based not only on studies showing these kinds of E. coli from commercial chicken meat and eggs can cause blood infections, brain infections, and urinary tract infections in mouse models. Studies on women with multi-drug-resistant urinary tract infections do report significantly more frequent retail chicken consumption. Similarly, elderly chicken eaters were significantly more likely to have Cipro-resistant bladder infections compared to those eating no chicken at all. Pork was also associated with increased risk, but not beef. There have been few observed associations between beef cattle, or retail beef, and human XPEC infections, suggesting that beef cattle are not a reservoir for human bladder infections, whereas in chickens, of the up to 90% of chicken carcasses harboring E. coli, about 1 in 5 isolates tested had the potential to cause urinary tract infections. What about eggs? We know retail chicken meat is contaminated with XPEC isolates that resemble the strains that cause human infections, but what about retail chicken eggs? Instead of 1 in 5 being XPEC in chicken meat, it was more like just 1 in 20 among eggs, closer to down around pork or beef levels. Researchers are so sure that chicken is the primary reservoir that when they find the same kind of strain in a vegetarian, they interpret that as people saying they're vegetarian but actually eating some chicken, or evidence of human-to-human transmission, or even shopping cart to human transmission. Remember how most people fail to sanitize their hands after picking up a package of poultry in the grocery store? And so then, even a shopper who's not purchasing poultry could still be exposed to poultry contamination, pushing the same cart after them. It's difficult to estimate how much XPEC exchange can be attributed to person-to-person contact after a chicken consumer's rectum has been colonized. Researchers went swabbing around public restrooms to try to quantify the risk. 1,000 samples from 56 public restrooms in 33 establishments. They found lots of evidence of E. coli in general, particularly in public park restrooms and fast food joints, more than gas stations, which surprised me. But this was really surprising. Women's rooms were worse than men's. But only about 1% of the samples they took were positive for XPEC bacteria, though they were recovered from non-toilet-associated sites that were not visibly contaminated, so one might touch it with bare hands after, turning the faucet off after you've washed your hands. So the risk may not be fully eliminated by careful hand washing or avoidance of fecal-appearing debris, though that's probably a good idea to avoid anyway. And using hand sanitizers after exiting the restroom, not to mention in the meat aisle after touching a package of poultry, may offer additional protection. What proportion of the 7 million bladder infections every year in the U.S. are due to chicken meat? If no more chicken were consumed, how many E. coli UTIs would be prevented? How much would the prevalence decline? It's hard to tell, because the time lag between the acquisition and asymptomatic colonization of the intestine with an XPEC organism and the development of an infection. So you eat some contaminated chicken today, and the UTI-causing XPEC bacteria may hang out in your colon for months before making an appearance, making its way into your bladder and triggering an infection. The reason we know it can take that long is by studying the intestinal population dynamics of UTI-causing E. coli between partners. Increased rectum-to-rectum transfers might be explained by the high levels of E. coli present in the urine of an infected woman, which could then be transferred over depending on certain intimate practices. Bottom line, there's compelling evidence that retail meat, particularly poultry, serves as an important reservoir for human exposure to antibiotic-resistant E. coli that is causing UTIs, urinary tract infections. Thus, instead of just UTIs, maybe we should call them foodborne UTIs, or footies, or maybe pronounced FUTIs. Sure, we could decrease the burden of these foodborne bladder infections by developing some sort of XPEC vaccine, or we could just cut down our contact with fresh or frozen poultry. No harm, no foul. I've talked about the benefits of beans and lentils and chickpeas, but do the benefits remain even when they're powdered? There are a bunch of bean pastas on the market now, made from bean powder instead of wheat powder. Does it have the same benefits as whole beans? In terms of blood sugar control, yes. No differences in blood sugar responses were observed between whole beans, pureed beans, and powdered beans. This study, however, failed to show a benefit. They gave people powdered lentils, chickpeas, peas, and did not see any cholesterol benefits, for example, compared to a potato placebo. Now, conceivably, the powdering process may have altered the properties of the fiber, but they were only giving people 100 grams a day, which is less than half a can of beans, and previous studies that have shown significant cholesterol-lowering benefits tended to use more than that. Another bean powder study also found no cholesterol effect, but they were only giving 15 grams a day. That's just like 15 beans a day. If you do a systematic review of all the randomized, controlled regular bean studies, significant benefits were found more like up around 130 grams a day. In other words, at least one full serving. If you ever get sick of pulse pastas and beans that are canned and cooked, sprouting is a cheap, effective, and simple tool for improving the nutritional quality of certain legumes. I've fawned over lentil sprouts previously as one of the healthiest snacks, along with kale chips and nori sheets. Anyone can make lentil sprouts at home super easy for pennies, fresh produce year-round on your windowsill. But any way to boost their nutritional quality even higher? Well, as a response to environmental stresses, plants modify their metabolism, and we may be able to take advantage of that to modify the composition and activity of plant foods. For example, plants are subjected to free radicals too, which can damage their DNA just like it damages our DNA. So to reduce excess free radicals, plants can ramp up their antioxidant defenses, which we can then take advantage of when we eat them. So, for instance, as a germination technique for chickpeas, if you irradiate them with gamma rays, you can boost their antioxidant defenses. But if you don't want to Bruce Banner your chickpeas into whole hummus, how about eliciting the nutritional and antioxidant potential of lentil sprouts with temperature stress instead? For example, what if you took your sprouts when they were 2 days old and put them in the fridge for an hour? Then you take them out and let them continue to germinate normally. Would that 1 hour of cold stress make them more nutritious? Or instead of putting them in the fridge, what if you lived in Phoenix and took them outside for an hour? Here's what happens to a measure of the antioxidant power of lentil sprouts germinated the whole time at room temperature, a slow rise with time. But just that 1 hour in the fridge on day 2, and days later significantly more antioxidant buildup. Same thing for an hour at 104 degrees Fahrenheit. What about then storing them in your fridge? Sprouts are usually consumed fresh. However, to keep them fresh, we usually stick them in the fridge. But there hasn't been any studies about the effects of fridge stores on the nutritional quality of sprouts until now. On days 3 through 6, you can see the phenolic phytonutrient content of sprouted peas decline, but keep them in the fridge, and they go up instead. The same thing with mung bean sprouts, which are the typical bean sprouts, whereas in lentils, no significant difference. We should still keep them in the fridge to prevent them from spoiling, but the best way to ensure maximum nutrition is to store them at body temperature by eating them. The consumption of berries can enhance beneficial signaling in the brain. Plant foods are our primary source of antioxidants and anti-inflammatory compounds, but some plant foods may be better than others, as I've explained before. 1 cup of blueberries a day can improve cognition among older adults, as shown in this randomized, double-blind, placebo-controlled trial, and the same thing in kids after just a single meal of blueberries, though 2 cups may work better than 1. That single hit of berries may also improve mood. A double-blind, placebo-controlled crossover study in which kids are asked a series of questions. Are you very slightly or not at all, a little, moderately, quite a bit, or extremely interested, excited, strong, etc.? Before and after drinking the placebo, no significant change. But 2 hours after consuming about 2 cups of blueberries, their positive mood scores significantly improved. They felt more enthusiastic, alert, inspired, attentive, that kind of thing. That was in young adults, ages 18 through 21. Same thing in 7 to 10-year-old children. Some dangerous new mood-enhancing drug, or Ritalin? No, blueberries, and just after a single meal. Now, blueberries can't do everything. Although a cup of berries certainly appears to improve brain function, no improvement in walking or balance was observed. Maybe if you tried 2 cups of blueberries a day? Let's do it. Would 6 weeks of 2 cups of frozen blueberries a day affect the functional mobility in adults over age 60? Let's find out. How awesome is it that this study was ever done in the first place? Anyway, randomized to blueberries or carrot juice as a control, measuring things like walking a plank, seeing if you can maintain your balance along a narrow path. 2 bright yellow ropes on the floor outlined the narrow path, and participants were instructed to walk down within the roped path. And the blueberries beat out the carrot juice. Significant improvements suggesting blueberry supplementation may provide an effective countermeasure to age-related declines in functional mobility. And looking back, they were thinking maybe they should have used something like cucumber as a control, since the carrots may have offered some benefit as well, making the blueberry results even more impressive. Overall, this study demonstrates the need for greater exploration of blueberry supplementation as a non-pharmacologic countermeasure to the public health issue of age-related declines in independence. Or to use the pun version, dietary interventions with phytonutrient-rich foods such as blueberries present a potentially fruitful strategy for combating some of the deleterious effects of age-related neurodegeneration. This is a graph of mortality versus coffee consumption, suggesting coffee drinkers live longer than non-coffee drinkers. This may be because coffee may have beneficial effects on inflammation, lung function, insulin sensitivity, and depression. This may be in part because of a class of polyphenol phytonutrients found in coffee beans called chlorogenic acids, proven to have favorable effects with studies like these, where they just give it alone in pill form and can show beneficial effects, such as acute blood pressure lowering activity, dropping the top and bottom blood pressure numbers within hours of consumption. OK, so which coffee has the most? We know how to choose the reddest tomato, the deepest orange sweet potato, since many of the plant pigments are the antioxidants themselves. How do you choose the healthiest coffee? More than 100 coffees were tested, and different coffees had different caffeine levels, but the chlorogenic acid levels varied by more than 30-fold. As a consequence, coffee selection may have a large influence on the potential health potential of coffee intake. So all those studies that show that 1 cup of coffee does this or that, what does that even mean when coffee can vary so greatly? Interestingly, the major contributor to the wide range was the coffee purchased from Starbucks, which had an extremely low chlorogenic acid content, averaging 10 times lower than the others. Maybe it's because they roast their beans too dark. The more you roast, the less there is. They appear to be partially destroyed by roasting. Caffeine is pretty stable, but a dark roast may wipe out nearly 90% of the chlorogenic acid content of the beans. The difference between a medium-light roast and a medium roast were not enough, though, to make a difference in total antioxidant status in people's bloodstream after drinking them. They both gave about the same boost. Other factors, such as how you prepare it or decaffeination, don't appear to have a major effect. What about adding milk? Longtime fans may remember this ancient video where the addition of milk was shown to prevent the protective effects of tea on artery function. Drink black tea and you get a significant improvement in vascular function within hours, whereas addition of milk completely blunted the effects of the tea. Here's the big boost in artery function you get drinking tea, but drink the same amount of tea with milk, and it's like you never drank the tea at all. They think it's the casein to blame, one of the milk proteins binding up the T phytonutrients. Bottom line, this finding, that the T-induced improvement in vascular function is completely attenuated after addition of milk, may have broad implications on the mode of tea preparation and consumption. In other words, maybe we should not add milk to tea. Or put cream on our berries. It appears to have the same effect on berry phytonutrients. Or chocolate. Check this out. Eat milk chocolate, and nothing much happens to the antioxidant power of your bloodstream. But eat dark chocolate, and get a nice spike within an hour of consumption. Yeah, but is that just because the milk in milk chocolate crowds out some of the antioxidant-rich cocoa? Milk chocolate may only be like 20% cocoa, whereas a good dark chocolate may be like 70% or more cocoa solids. No, it's not just that. Here's how much of this cocoa phytonutrient you get into your bloodstream eating dark chocolate compared to milk chocolate. But eat that same amount of dark chocolate with a glass of milk, and it blocks about half. OK, that's cocoa beans. What about coffee beans? When milk was added to the coffee in like a test tube, antioxidant activity decreased by more than half with just a splash of milk, and down like 95% in like latte or something with lots of milk. OK, but what happens in a test tube doesn't necessarily happen in a person. I mean, you don't know until you put it to the test. And indeed, over the course of a day, significantly fewer chlorogenic acids made it into people's bloodstream drinking coffee with milk compared to black, cutting absorption by more than half. What about soy milk? In a test tube, coffee phytonutrients do appear to bind not only to dairy proteins, but also egg and soy proteins. You can see how they did this like computer modeling showing how these coffee compounds can dock inside the nooks and crannies of dairy, egg white, and soy proteins. But what happens in a test tube or a computer simulation doesn't necessarily happen in a person. Eggs haven't been put to the test, so you don't know if having omelets with your black coffee could impair absorption, and neither has soy milk. Until now. Yeah, either way, soy milk has some inherent benefits over cow's milk, but does it have the same nutrient-blocking effects? And the answer is no. No significant difference in the absorption of coffee phytonutrients drinking coffee black or with soy milk. What seemed to be happening is that the soy proteins do initially bind the coffee compounds up in the small intestine, but then your good bacteria can release them so they can be absorbed down in the lower intestine. So, considering the reversible nature of binding, as opposed to the dairy proteins, it seems not to be as relevant as to whether or not you add soy milk. There are at least 33 carcinogens in marijuana smoke, such as polycyclic aromatic hydrocarbons, which are products of combustion found in grilled meat and flowing through the bodies of those who smoke marijuana, similar to what one sees flowing through the bodies of cigarette smokers. That's really remarkable. Most tobacco users inhale way more smoke into their lungs over the course of a day, so on a puff-by-puff basis, is marijuana smoke really that much worse? Well, it does seem to contain more benzopyrene and benzanthracene, which are polycyclic aromatic hydrocarbon procarcinogens, compared to unfiltered cigarette smoke. But it may just be that cannabis users inhale more deeply and then hold the smoke in longer, which can end up depositing 4 times more tar in the lungs, amplifying exposure to these carcinogens. And unfortunately, bubbling the smoke through water, like in a bong, does not appear to reduce the risks of tar buildup. Yeah, marijuana smoke tar may have similar tumor-promoting effects as cigarette smoke in mice, but what about in men and women? Longtime marijuana users do have more cancer, more lung cancer, more oral cancer, voice box cancer, but only, it seems, because they also tend to be more likely to also smoke tobacco. After cigarettes are taken out of the equation, no increased risk was found. Same with head and neck cancer. One study found increased risk, but 5 studies reported no association, and 1 study found decreased risk. So yeah, regular use causes airway injury that can lead to chronic bronchitis, but no evidence of long-term lung damage like emphysema, and despite the presence of carcinogenic components, no apparent increased risk of lung cancer, though evidence is mixed regarding the risk of heavy long-term use, and that may be the crux. In terms of smoke exposure, even smoking a joint every day for 10 years may only translate to 6 months of pack-a-day cigarette smoking. In most studies on tobacco smoking and lung cancer, 6 months in a lifetime might get you classified as a never smoker. It may take a couple years of cigarette smoking to significantly bump lung cancer risk, and so that would be like smoking a joint every day of your adult life. No wonder we can't find a lung cancer link with casual marijuana use, though there is an alternative explanation. Maybe the anti-tumor effects of the cannabis plant is counteracting the tumor-promoting effects of the carcinogens in the smoke. Wait, anti-tumor effects? Yes. In fact, the original demonstration of an anti-cancer effect, dating back to 1975, was against lung cancer cells, showing that THC can suppress their growth in a petri dish. This kind of data has led to wild claims of cancer cures on the internet, extrapolating the results of this preclinical work, meaning like in petri dishes and test tubes, to humans without any basis in fact, as cannabis, according to this 2016 review, has not been studied clinically as a treatment for malignancy in people. But that's not really true. There was a pilot study performed on terminal brain cancer patients Cannabis and cancer, reality or pipe dream quackery? Among alternative cancer treatments, cannabis inhibits a peculiarly politicized position, hailed as a suppressed panacea by some, denounced as a dangerous drug by others. At the far end of the spectrum are those who insist cannabis helped cure their cancer. The promise, and even the hype, can reach hysterical proportions, with claims of cannabis cancer cures circulating in cyberspace at a furious pace. The problem is that sometimes a patient will have a cancer that's curable with conventional therapies, like you could cut it out before it spreads, but forgoes that treatment in favor of something that just got good online testimonials. Yes, cannabis compounds like THC can reduce brain tumor volume in mice, or suppress cancer cell growth in a petri dish. But it turns out mice and rats are not people, and what's observed in vitro does not necessarily translate into human clinical medicine. Why not just give it a try, though? Because there's other evidence that cannabis compounds may encourage cancer growth, like THC inhibiting anti-cancer immunity, or inducing cancer cell proliferation, enhancing breast cancer growth and metastasis by suppression of the anti-tumor immune response. Yeah, but in mouse mammary tumors, you don't know what happens in people until you put it to the test. But because of legal reasons, few human studies have been done. But thankfully, after years of a deep freeze on cannabis-related research, funding, and materials, a thaw is starting. But where do you even start? Well, if cannabis compounds, cannabinoids, are postulated to have a potential anti-cancer effect working through the cannabinoid receptors, it would follow that trying it on cancer of the brain, where the receptors are most densely concentrated, would be a good place to start. OK, well, one of the most devastating forms of cancer is glioblastoma, a fast-growing type of malignant brain tumor, and that's the first cancer that was put to the test. Cannabis compounds sometimes inhibit tumor growth in lab animals. However, anti-tumor effects had never been tested in humans, so here we go. The first clinical study on cancer, specifically a pilot study in which 9 patients with recurrent glioblastoma, meaning they had the tumor cut out, they had the radiation treatments, but the cancer is back and is growing. Then they administered the THC straight into the tumor. Basically, they went back into surgery, had a scoop carved out of the center of their tumors, and they stuck a catheter in the middle with the other end sticking out of their heads so they could drip the THC straight into the tumor with a syringe. THC was already tested on biopsy specimens and showed it was able to kill some of the cancer cells off in a petri dish. So what happened when it was tried on the patients themselves? The patients all died in a matter of months. In a few patients, it seemed to work for a few weeks maybe, but then the tumor took back off despite repeated treatments. This looks like their most dramatic result. Here's where the tumor started before the treatment, and at 4 weeks had dramatically shrunk down. A 35-year-old guy. The whole family must have been beside themselves. But then it came back with a vengeance, and despite more infusions, got worse, and then he was gone. With no control group, the effect of the treatment on overall survival is unclear. This was both the first clinical trial on cancer and the only clinical trial on cancer, even though it was published over a decade ago. But the good news is, there are more than 15 trials currently underway, perhaps the most exciting of which is a phase 2 trial in Israel, again looking at advanced cancers that are progressing despite all standard treatments. In the meanwhile, if you are undergoing a standard treatment like chemo, at least we know that cannabis may help with some of the side effects. Experimentally, if you have people stop brushing their teeth, plaque starts to build up, and within a few days the gums start to get inflamed. You can't see anything yet, but if you take a biopsy at the gum line, you can see the inflammation starting to spread. And within a few weeks, overt gingivitis becomes apparent, where your gums can get red, swollen, and bleed easily. And if you don't do anything about it, you can develop periodontal disease, where the inflammation creeps down into the supporting structures of the tooth, the bone and ligaments, setting you up for tooth loss. OK, but how did we get along for millions of years without brushing? Yeah, dental disease is almost universal these days, but thousands of years before the invention of the toothbrush, there are skulls with perfect teeth. Now you can say, yeah, but that was also thousands of years before the invention of candy bars, but you don't know until you put it to the test. OK, yeah, but where are you going to find people to not only stop brushing, but also to forego eating processed junk? Security guards. That's how you do it. It's one of these Survivor-type TV shows where people were forced to live under Stone Age conditions, so no toothbrushes, toothpaste, dental floss, toothpicks, or other oral hygiene products for a month. Now, they could use a twig or something, but they're pretty much on their own. But no candy bars either, right? They were going for about 4,000 BC, so lots of whole grains with supplemental salt, herbs, honey, milk, and meat. And then they could go out and pick berries and see what they could catch. So what happened? With no oral hygiene, their plaque built up, but their gums got healthier. This is measuring BOP, bleeding on probing, whether or not your gums bled when poked with a dental tool, a measure of gingivitis. And in almost every case, they got better. Here are before and after pictures. Yeah, lots of plaque buildup, but actually healthier gums. How is that possible? Well, many of the more disease-causing bacteria seem to have disappeared from their mouths. They suggest this could be from the lack of refined sugars, but they were eating honey, so it wasn't a sugar-free diet. But what they were eating was lots of whole grains and berries, rich in antioxidant phytonutrients with anti-inflammatory properties. So maybe it was a combination, sugar intake restriction combined with the intake of really healthy foods. Thus, all those experimental studies where people stop brushing, their gums inevitably get inflamed, may only be applicable for people eating lots of processed foods rich in sugar and low in anti-inflammatory whole plant foods. What about the role of nutrition in periodontal health? Gingivitis can lead to periodontitis, an inflammatory disease of the supporting tissues of the teeth, which, if untreated, can lead to the progressive loss of the bone that holds the teeth in place. Now, part of the development of periodontal disease may involve oxidative stress. So not only do we need to reduce our intake of pro-inflammatory foods like refined carbs and saturated fats, maybe it would help if we sought out foods that are antioxidant-rich. So is there an association between dietary vitamin C intake, for example, with periodontitis? Apparently so, with increasing risk of periodontitis associated with lower levels of vitamin C intake, but you don't know until you put it to the test to figure out what effect vitamin C depletion and supplementation would have on periodontal health. They basically locked everyone up for 3 months so they can provide controlled amounts of vitamin C, and measures of gum inflammation were directly related to their vitamin C status. On about 1 orange worth of vitamin C, their gums improved, but then down to 5 milligrams a day, they got worse. But then on 10 oranges worth a day, they got better, and then worse again, went back down to 5. Pretty convincing, though 5 milligrams a day is like scurvy level. I mean, we know that your gums start bleeding, your teeth can fall out when you have scurvy, but that doesn't mean taking extra helps. And indeed, 1,500 milligrams of vitamin C a day did not seem to help prevent gingivitis, and even 2,000 a day failed to help periodontitis sufferers. Maybe vitamin C is just too weak of an antioxidant? OK, what about lycopene, the powerful antioxidant pigment that makes tomatoes red? It worked, but that was from injecting the stuff directly into the gum pocket with a syringe. Does it work if you just eat it? Let's find out. A randomized, placebo-controlled clinical trial on the efficacy of lycopene in the treatment of gingivitis. 2 weeks of less than a single tomato a day's worth of lycopene versus placebo for 2 weeks, both along with a standard dental treatment, which helped a 10 to 20% reduction in gingivitis in the placebo group, but nearly 30% improvement within just 1 week in the lycopene group. And this was just like the amount of lycopene found in a teaspoon and a half of tomato paste a day. Totally doable. OK, so tomatoes may help with gingivitis. What about periodontitis? Another randomized, double-blind, placebo-controlled trial, again, treated with usual dental cleaning plus either that 1 tomato a day's worth of lycopene or placebo for 2 months, and significant improvements in plaque gingivitis and bleeding, though not probe pocket depth and clinical attachment. You can see the difference. See how much better their gums look? They conclude that supplementation with lycopene seems to have augmented the healing sequence of inflamed gingival tissues. OK, but that was with a whole tomato's worth a day. How about half a tomato's worth, or just 3/4 of a teaspoon of tomato paste worth of lycopene a day? It didn't work. No difference. So it looks like you have to go the whole tomato. Macrobiotic diets have been described by the American Medical Association as one of the most dangerous dietary regimens, posing not only serious hazards to the health of the individual, but even to life itself. After all, macrobiotic diets are predominantly vegetarian, with a great emphasis placed on whole grains. What's wrong with that? Well, they also used to tell people to not drink water, which isn't good, and to avoid fruit. So much so, it's resulted in modern-day cases of scurvy. Now, thankfully, the macrobiotic diet has evolved over the past 30 years. This is the more kind of contemporary version, in emphasis on whole grains, vegetables, and beans, while minimizing most meat, eggs, and dairy. I don't like them restricting fruits, don't like all the added salt, but compared to the standard American diet, it's got a lot of things going for it. Only 1/4 of the saturated fat intake, less than half of the sugar intake, a very respectable fiber intake, 2.5 times the national average, but actually taking in more sodium. So while the macrobiotic diet is an anti-inflammatory diet, has a negative dietary inflammatory index score as opposed to the pro-inflammatory American diet, some of the most anti-inflammatory foods are herbs and spices. So instead of adding all that sea salt and soy sauce, the macrobiotic diet could be improved by using natural seasonings instead. OK, but has the macrobiotic diet ever been put to the test? Yes, for diabetes. The restriction on water probably wouldn't help, as higher plain water consumption is associated with lower type 2 diabetes risk, though part of that may be because they're drinking less soda. And fruit restriction is probably not helpful, since fruit consumption is associated with significantly reduced risk of type 2 diabetes as well. But hey, same with green leafy vegetables, which is where the macrobiotic diet can really shine. It includes lots of greens. Look, you can do randomized, double-blind, placebo-controlled crossover studies of kale and show that it suppresses the after-a-meal increase in blood sugars. Eat a meal of white rice, chicken, and eggs, and get a big spike in blood sugar, though significantly less adding just a tablespoon of dried kale powder, as opposed to some kind of placebo powder, though the effect is visually exaggerated by their y-axis shenanigans. And macrobiotic diets use whole grains, which can significantly improve insulin sensitivity compared to refined grains, which may be due in part to all the wonderful things fiber can do to help our good gut bacteria thrive, which could potentially lower inflammation and decrease diabetes risk. But you don't know until you put it to the test. Just 3 weeks on a strictly plant-based diet, composed mostly of whole grains, vegetables, and beans, and they got about a 10% drop in blood pressure, a whopping 35% drop in LDL bad cholesterol, and a 38% drop in fasting blood sugars in just 21 days. Were these changes statistically significant? Here's some 3-month p-values for you. Those are my kind of p-values. In other words, yes, the changes were significant in every possible way. Similarly, short-term interventional studies on diabetics with the so-called MAPI-2 macrobiotic diets have been performed across 4 continents. The MAPI comes from the guy that came up with the diet, Mario Pianesi, a strictly plant-based diet, based mostly on whole grains and vegetables, with legumes and some seeds, and decaf green tea as the preferred beverage. Look at these extraordinary numbers: a near 40% drop in fasting blood sugars, near 27% drop in LDL cholesterol in 21 days. Now, they did lose weight, a few pounds a week, but those kinds of results were way more than one would expect with weight loss. And here's the kicker: that 40% drop in blood sugars was after cutting their insulin in half. So those numbers greatly underestimate the effects. Better results on fewer drugs. That's the power of plants. Why are macrobiotic diets apparently so effective at reducing blood sugar levels in diabetes within just a few weeks' time? Because the diet is centered around whole grains, brown rice, barley, and millet, maybe the high fiber intake is improving the gut microbiome, the friendly flora in the colons of diabetics, and that's leading to a reduction in insulin resistance? Or maybe it's because it also has lots of vegetables. Maybe it's kind of correcting some kind of low-grade acidosis from the high levels of animal protein in their regular diets. Regardless, this was after just 21 days. Can macrobiotic diets also help with longer-term blood sugar control? How about a 6-month dietary intervention with wildly out-of-control blood sugars? Hemoglobin A1C offers a sense of one's average blood sugars over the previous few months, so an A1C level of 5 would mean over the last few months your blood sugars have been in the kind of double digits most of the time, meaning your sugars have been normal, healthy, non-diabetic. But an A1C of like 6 is pre-diabetes territory, and 6.5 can be a sign of full-blown diabetes. But under 7 is considered controlled diabetes. That's what diabetics are striving towards with pills and insulin injections, and anything over 7 is considered out-of-control diabetes. The average A1C level in the macrobiotic diet study started out off the charts at 12.6, meaning for months they've been averaging blood sugars in the 300s, despite all being on insulin injections. But then they were placed on the so-called MAPI-2 diet, a strictly plant-based macrobiotic-style diet centered around whole grains, vegetables, and beans, with some sesame seeds and green tea. What happened? A1C levels started out with a wildly out-of-control diabetic 12.6, despite daily insulin injections, and 6 months eating that diet ended up averaging a non-diabetic 5.7. Now, you ready for this? That was after they all were able to eliminate their insulin. They went from 100% on insulin without a controlled diabetes to 0% on insulin, averaging non-diabetic blood sugars. That's the power of plants. And 3/4 were off all their diabetes medications completely in just 6 months' time. And what are the side effects? How about LDL cholesterol dropping 20%, triglycerides dropping nearly 40%, though of course anyone starting a strictly plant-based diet must ensure a regular, reliable source of vitamin B12. All we need now is a randomized controlled trial, and here it is. Type 2 diabetics randomized to the macrobiotic diet versus the recommended American Diabetes Association type diet. So here's an example of a typical day on the macrobiotic diet. A savory whole grains cake for breakfast with green tea with brown rice sesame balls for a snack. Lunch was a vegetable millet soup and a brown rice salad with lots of vegetable sides, and adzuki beans, more whole grain snacks, and a dinner similar to lunch, vegetable barley soup, lots of vegetables, chickpeas, green tea throughout the day. Whereas the more standard diabetic diet group got a day like this: low-fat milk, whole wheat bread, kind of a Mediterranean lunch with vegetables and beans, fruit for a snack, and a bean and vegetable soup, whole grain bread. Agretti is like a green leafy vegetable, and baked fish. I have to say, that's a pretty healthy, controlled diet. I mean, they could have compared it to some trashy diet, but they wanted to be like, look, this is what the diabetes groups say is best, so let's stack our diet against theirs. OK, so what happened? The macrobiotic diet won out on every measure of blood sugar control. Check out these numbers. They all started out with fasting blood sugars in the 120s. That's bad, but they were, after all, diabetics. Normal fasting blood sugars, like when you wake up in the morning before breakfast, should be at least down in the double digits, under 100. When they put people on this relatively healthy Diabetes Association diet, their blood sugars got better over the 3-week study, from the 120s down into the 1-teens. So that's like the best the official diabetes-recommended diets can do. Compare that to an isocaloric macrobiotic diet, meaning the same number of calories. This is what the macrobiotic diet did, better within days, and hitting normal fasting blood sugars within a week. 100% of those on the macrobiotic diet got down to at least under 110, whereas less than half of those on the diabetes diet did. And this was on fewer drugs. In the control group, 1 person was able to reduce their oral hypoglycemic medications, whereas 5 of the 7 on such drugs in the macrobiotic group had to stop taking them. Otherwise, their blood sugars would have fallen too low. So better results on fewer drugs. That's the power of a really healthy diet. And just as an aside, what a poke in the eye with a sharp stick this study was to the low-carb crowd. Look at this. They took diabetics and put them on a 73% carbohydrate diet, adding 100 grams of carbs to their daily diet, and in the form of grains. And what happened? Did their blood sugar skyrocket out of control? No, they got better, significantly better, in a matter of days, with average fasting blood sugar starting out at 129, falling to 95, and holy moly, look at their LDL cholesterol down to 62, a nearly 48% drop in 3 weeks. In the 19th chapter of the Quran, Mary is giving birth to Jesus. I didn't even know Jesus was in the Quran, the things they don't teach you in Hebrew school. It says the pains of childbirth drove her to the trunk of a palm tree. She cries out, and she is answered by Gabriel, archangel, and evidently obstetrician. Who knew? Shake the tree, he says, and it will drop upon you ripe fresh dates, and you'll be all better. No epidural necessary. Do dates really help with labor and delivery? It would take a little over 2,000 years, but researchers finally decided to put it to the test. They had some anecdotal evidence that dates might be helping, but they wanted to know for sure whether the addition of date fruit for the last few weeks of pregnancy would reduce the need for labor induction or augmentation. That's where you give drugs to induce uterine contractions to initiate or accelerate labor. It's one of the most commonly performed obstetrical procedures in the U.S., dramatically increasing over the last few decades, from less than 10% of deliveries to now nearly a quarter. There are certainly legitimate medical indications, but are often done just for convenience. And not necessarily the convenience of the patient, but the provider, who may also have perverse financial incentives and other reasons to want to speed things along. Dates might not help with those factors, but might they help foster a normal, spontaneous delivery? Let's find out. A prospective study, women eating 6 dates a day, that's totally doable, during their last month of pregnancy versus no dates at all. And the women who consumed date fruit had significantly better cervical dilation, significantly higher proportion of intact membranes, that's a good thing, and spontaneous labor occurred in 96% of those who consumed dates, compared to 79% of women in the non-date group, with significantly less drugs used. And the labor was shorter, as in about 7 hours shorter overall. It is therefore concluded that the consumption of date fruit in the last 4 weeks of pregnancy significantly reduced the need for induction and augmentation of labor. The results warrant a randomized controlled trial. Wait, what? The women weren't randomized? They even talk about how it was hard to find women who would agree to not eat dates, because it's part of their cultural beliefs. So you can totally imagine how there could be all sorts of differences between the women who ate dates and those who agreed to go without that could account for the findings. Maybe the date eaters were more religious, or higher socioeconomic status, or who knows? Yeah, you could argue, what's the downside? Might as well give dates a try, but that's not good enough. I want to know if they actually work. But there had never been a randomized controlled trial until 3 years later. The effect of late pregnancy consumption of date fruit on so-called cervical ripening in first-time mothers. In the last few weeks of pregnancy, hormonal changes cause the cervix, the opening to the uterus, to start to ripen, to soften, so that when the contractions start, it can more easily dilate open. At this stage, the cervix loses its integrated structure, and therefore becomes soft and dilated as soon as strong contractions begin. Through a ripe cervix, you can push a baby out with like 20 pounds of pressure per square inch, but if the cervix isn't there yet, it can require more like 200 pounds of pressure. So it goes without saying that cervical ripening before the onset of labor is important if you want a normal vaginal delivery. The search for a safe, inexpensive, and easy method of facilitating cervical ripening is therefore of great interest. So let's randomize a few hundred women, starting at like the 37th week, to eat about 6 dates a day, or not, until their first contraction. Cervical ripening is rated with what's called a Bishop score. Normally, a score of 5 or less indicates an unfavorable cervix, whereas 8 or more, and you're good to go. And the average Bishop score in the women randomized to the date group was significantly higher, closer to 8, whereas the date-free group was down at around 5. And the cervix was more dilated in the date group. And hey, dates are healthy anyway, so maybe dates should be recommended for pregnant women to help with cervical ripening, particularly in the last few weeks of their pregnancy. A randomized controlled trial of hundreds of pregnant women found that having women eat around 6 dates a day for a few weeks before giving birth can significantly improve cervical ripening, the readiness of the cervix, the opening to the birth canal. You can also use drugs or surgery to prep the cervix. Oxytocin is the most common agent. You may have heard doctors talking about Pitocin, that's the brand name. Although it's effective, its use is associated with multiple potential adverse side effects, which can affect both the mom and the baby. If only there were a safe, simple, side effect-free solution, well, dates may fit the bill. The use of oxytocin for labor induction in the date group was less than half that of the control group, and the few on dates that were induced had more successful deliveries. In an earlier study, in which prior date consumption appeared to shorten labor by more than 6 hours, speculated that maybe dates themselves have oxytocin-like effects. All right, how about a head-to-head trial comparing the efficacy of dates versus oxytocin in the management of postpartum bleeding? Postpartum hemorrhage, excessive blood loss after birth, is one of the major complications of pregnancy, and the leading cause of maternal mortality. As the placenta peels off, the uterus is supposed to contract to staunch the bleeding. And if the uterus doesn't have sufficient muscle tone, you can give an injection of oxytocin to help squeeze off the blood loss. Like all drugs, though, it can have side effects, sometimes causing a dangerous drop in blood pressure. There's also various devices that can be inserted to apply pressure, and worse comes to worse surgery. But why not try fruit first? Available, cheap, side effect-free, yeah, but does it work? They set up a randomized clinical trial to find out. Immediately after the placenta comes out, women were given a one-time dose of like 5 dates, or an intramuscular shot of oxytocin. Then they just collected all the blood to see which worked better. Overall, 3 hours after delivery, the blood loss average in the date group was significantly less than in the oxytocin group, by about 1/4 of a cup. Check this out. See how the date group was mostly in the lowest category, under 2/3 of a cup of blood loss, whereas the drug group was mostly about a cup or more. Conclusions. Use of oral dates, I don't know how else you'd take them, after delivery decreased bleeding more than intramuscular oxytocin, and it's a good alternative in normal delivery. But wait, if dates have oxytocin-like effects to contract the uterus, shortening labor by helping to induce earlier uterine contractions, might date consumption increase the risk of premature labor? I guess we'll never know until now. The effect of date fruit consumption on the length of gestation. Starting at about 38 weeks, women were randomized to eat 7 dates a day or not, and eating dates did not affect delivery dates. But what it did do is significantly reduce the need to induce labor with drugs. Half of the non-date group were induced versus 30% less in the 7 dates a day for a week group. An induction of labor is serious business. It can increase complications such as bleeding, C-sections, uterine hyperstimulation, and even uterus rupture. And apart from the complications, women who are induced tend to feel less satisfied with their birth experience. Therefore, date consumption in late pregnancy is a safe supplement to be considered, as it reduced the need for labor intervention without any adverse effect on mother and child. The only thing we're missing now is a double-blind study, not just a randomized trial, but a placebo-controlled study, right? I mean, the women in the date group obviously knew they were eating dates, and maybe that had some kind of placebo effect. The only double-blind study I could find on dates and delivery is in Arabic, but the English abstract describes how women just entering their active labor phase were given a date syrup or placebo. That's brilliant, right? Hard to make a placebo date, but you could make some kind of placebo syrup, like, I don't know, molasses or something, right? Note when they say honey date syrup, they're not talking about a syrup of honey and dates, but a syrup made out of honey dates, which is a soft, melt-in-your-mouth variety, easy to whip into a syrup. And normal labor progression was evidently higher in the date group, around 98%, compared to less than 70% in both the placebo and control groups. And labor duration was also shorter in the date group, like 2 hours shorter. So on your due date, maybe we should give dates their due. A summary of studies found no acute effects of cell phone radiation, like nausea, headaches, dizziness, fatigue. But they were just looking at the short-term effects, not considering any of the data on the potential long-term effects. No acute effects, so future research efforts should concentrate on possible chronic effects. I've explored the studies on brain tumors and on the effects of the auditory nerve in the ear, but that's not all there is on the side of your head. There's your brain, your ear, and your parotid gland, the big salivary gland right next to your ear. About 1 in 1,000 people develop salivary gland cancer in their lifetime. So the question is, does cell phone use increase the chances of parotid gland tumor development? Well, if you have 100 people drool into a test tube, the saliva of those who use a cell phone more than an hour a day does appear to have significantly less antioxidant capacity than those who talk less. So considering the major protective role of antioxidants to protect against free radical-induced DNA damage that can lead to cancer, this could be a potential route by which cell phone increases salivary tumor risk, but this was just an observational study. Maybe those who are on their phones all day tend to eat worse diets than those who talk less. I don't know. This study is a little more convincing. They found that saliva taken from the salivary gland on the side of the head they were using the phone on had higher levels of inflammatory markers compared to saliva taken from the same person, but just from the non-phone side of their head. Now, this increase in inflammation isn't necessarily from the cell phone radiation, but may just be from the heat generated by the phone. Just pressing anything warm against your face for an hour a day might not be good for your glands. Does the increased oxidation and inflammation actually translate out into cytogenetic abnormalities, meaning cell and chromosomal abnormalities in your mouth? Those who use cell phones a lot do appear to have an increased number of broken eggs in their tongues. What? That's a rather playful description of a cytogenetic abnormality associated with cancer. OK, but what we really care about is cancer. Does cell phone use increase the chances of parotid gland tumor development? This is the first systematic review ever published to evaluate that, and cell phone use does appear to be associated with increased risk. This is a good time to explore absolute versus relative risk. If you were asked whether you'd be willing to take a daily pill to reduce your chances of dying from a heart attack by 50%, you might jump at it. But if you're so young and healthy that your risk of that is only like 2 in 1,000 over the next 10 or 20 years, then taking those 5,000 or so pills may not be worth it for you to go from 2 in 1,000 to 1 in 1,000. 50% sounds great, but if you're talking about a really rare event, then it's less exciting. So even if cell phones did increase risk 28%, then a lifetime of cell phone use would only increase your risk of getting such a tumor from a 1 in 1,400 chance to about a 1 in 1,100 chance. If you want to reduce your risk, though, both the heat and cell phone emissions are largely a local phenomenon, so you can use a speakerphone or headset to reduce exposure, or you can do more texting. Basically, until we know more, the adoption of such precautions is not unreasonable, particularly among young people, something that concerns some researchers enough to recommend young children consider minimizing their use altogether. Ginger has been used in India and China to treat illnesses for thousands of years. But they also used mercury, so that doesn't really tell you much. That's what we have science for. But when you see titles like this in the medical literature on the beneficial effects of ginger on obesity, for example, you may not be aware they're talking about the beneficial effects of ginger on fat rats. Wait, why don't they just do human clinical studies? The lack of clinical studies may be attributed to, for example, ethical issues and limited commercial support. Limited commercial support, I can see. I mean, ginger's dirt cheap. Who's going to pay for the study? But ethical issues? We're talking about feeding people some ginger. Studies like this are relatively cheap and easy to do cross-sectional studies, where you take a snapshot in time of ginger consumption and body weight, and you do see that people who are obese tend to eat significantly less ginger, and so they suggest this demonstrates that the use of ginger could have relevance for weight management. But maybe ginger consumption is just a marker of a more traditional, less westernized junk food diet. I mean, you don't know until you put it to the test. A randomized controlled trial to assess the effects of a hot ginger beverage, by which they just meant 2 grams of ginger powder in a cup of hot water. So about 1 teaspoon of ground ginger stirred into a teacup of hot water. That's about 5 cents worth of ginger. And after the ginger, the participants reported feeling significantly less hungry, and in response to the question, how much do you think you could eat?, described lower prospective food intake. Now, The control was just hot water alone, so the participants knew when they were getting the ginger, so there could have been a placebo effect. They considered just stuffing the ginger into capsules to do a double-blinded study, but they think part of the effect of ginger may actually be through taste receptors on the tongue, so they didn't want to interfere with that. Not all the effects were just subjective, though. 4 hours after drinking, the metabolic rate in the ginger group was elevated compared to control, though in a previous study, when fresh ginger was added to a meal, there was no bump in metabolic rate. The research suggests that this may be due to the different method of ginger administration, giving fresh instead of dried, and there are dehydration products that form when you dry ginger that may have unique properties. Now, although satiety and fullness were greater with ginger compared to control, the researchers didn't then follow the participants out to see if they actually ate less for lunch. The problem is there's never been a randomized, double-blind, placebo-controlled study of that much ginger and weight loss until now. 12 weeks, that same teaspoon of ginger powder a day, but this time hidden in capsules, and consumption of ginger for 12 weeks significantly reduced body mass index. Check it out, no change in the placebo group, but a drop in the ginger group. Though body fat estimates didn't really change, which is kind of the whole point. What about using ginger to pull fat out of specific organs like the liver? Evidently, treatment with ginger ameliorates fructose-induced fatty liver in rats. You know what else would have worked? Not feeding them so much sugar in the first place. But there's never been a human... you know where this is going, until now. Ginger supplementation in non-alcoholic fatty liver disease, a randomized, double-blind, placebo-controlled study, a teaspoon of ginger a day or placebo for 12 weeks. They were all told to limit their dietary cholesterol intake— I've got a video on why that's important— and get more fiber and exercise, so even the placebo group should improve. But did the ginger group do any better? Yes. Daily consumption of just that teaspoon of ground ginger a day resulted in a significant decrease in inflammatory marker levels, and improvements in liver function tests, and a drop in liver fat, all for 5 cents worth of ginger powder a day. And what are the side effects? A few gingery burps? I searched for downsides and didn't find any, other than, of course, ginger paralysis. What? In 1930, thousands of Americans were poisoned by a ginger extract. First of all, who drinks ginger extract? Oh, 1930, it was Prohibition. So they bought ginger extract as a legal way to get their hands on alcohol. Little did he realize that the bootleggers had been taking advantage of the demand, swapped in a cheaper ginger substitute, a varnish compound, in order to make greater profits. The moral of the story being, don't drink varnish. The first energy drink dates back more than a half-century. Dr. Enough launched in 1949. Now there are more than 100 brands, an industry now selling $50 billion of the stuff a year. They're popular on military bases, but some military leaders have questioned their safety based on data like this: the skyrocketing number of energy drink-related emergency room visits over recent years. But if you look at some of the reports, you see cases like this. 24-year-old guy who didn't feel well after drinking a can of energy drink, and 3 bottles of vodka. Because energy drinks are often co-consumed with other substances, it's hard to tease out the culprit. Same problem with population studies. Sure, adolescents drinking energy drinks are at risk of a wide range of negative outcomes, but energy drink consumers are also more likely to drink soda, and have other unhealthy habits, more likely to binge drink, take diet pills, and engage in other risky behaviors. So the only way to tease out the energy drink component is to put it to the test. One of the concerns that has been raised by public health advocates in terms of potential negative effects is increased blood pressure. But have people chug a can of Red Bull, and 30 minutes later no significant change in blood pressure? OK, but that was the little 8-ounce can. What about the 16-ounce big cans of Red Bull? 40 minutes later, no significant change there either, so concerns about energy drinks raising blood pressure were dismissed as overblown, until the bomb dropped in 2014. Red Bull did indeed significantly raise blood pressure after all. The reason the earlier studies missed it is because the spike doesn't start peaking until like an hour after consumption. So if you just look at like 30 minutes after consumption, all seems fine. But the worst is yet to come. And the big shocker was that cerebral blood flow velocity, blood flow in the brain, took a dive. Energy drinks are promoted as having beneficial effects, but this instead would suggest they're potentially harmful because of the extra cardiac workload and decreased brain blood flow velocity. Researchers subsequently looked at other brands. Here's Rockstar brand energy drink, significantly elevating blood pressure within just 30 minutes. Yeah, but wait a second, is it just the caffeine? I mean, is it any different than just drinking a cup of coffee? To figure that out, you'd have to compare the effects of an energy drink with just a plain drink with the exact same amount of caffeine. But there's never been such a study. Until now, a randomized, double-blind, controlled crossover study in which young healthy volunteers were randomized to drink 2 large cans of an energy drink or a controlled drink that had the sugar and the same amount of caffeine, but none of the other proprietary blend ingredients like taurine, carnitine, ginseng, guarana, all the other stuff they add. And it turns out it wasn't just the caffeine. Significantly higher blood pressure on the energy drink than the exact same amount of caffeine in the control group. What's this higher QT interval thing, though? On an EKG, it's the distance from the beginning of the downward Q wave to the end of the bump of the T wave. OK, so who cares? QT prolongation, which is what the energy drink did, but not the caffeine, is a recognized marker of increased risk of, fatal arrhythmias, fatal heart rhythms. Well, that doesn't sound good. OK, but by how much? Prolongation of the QT interval by more than 60 milliseconds is a marker for life-threatening arrhythmias, and the energy drink only prolonged it by about 10. But there have been drugs pulled from the market, profitable drugs, bringing in billions of dollars because of a 5 to 10 millisecond prolongation. So we really need to start investigating some of these other ingredients in energy drinks. For example, in 2008, authorities found cocaine in Red Bull drinks. The Red Bull manufacturer insisted, however, that they were just adding the coca leaf for flavor, and that all the active cocaine was removed. Given the global popularity of the multi-billion-dollar energy drink industry, it's critical we figure out if there are any potential adverse effects. There are currently more than 500 energy drink products for sale on the market today. The most popular and most studied is Red Bull, a single can of which was found to bump blood pressure by 3 or 4 points within 90 minutes of consumption. What about all the other energy drinks? Studies show they similarly increase blood pressures 3 or 4 points on average. Oh, but come on, 3 or 4 points? What's the big deal? 20% higher risk of dying from a stroke is the big deal, and 12% higher risk of dying from a heart attack. Yeah, but that's if you have elevated blood pressure day in, day out. To see if Red Bull can increase your day-long average blood pressure, you'd have to put it to the test, a comparison of the effects of energy drink versus just caffeine supplementation on 24-hour blood pressure. The FDA imposes a limit on caffeine in soda, but the way energy drink manufacturers get around that is by claiming that their carbonated sugar water is not soda, but a natural dietary supplement. But Red Bull doesn't have any more caffeine than a cup of coffee. The question is, what are the effects of all the other proprietary ingredients they add to the energy drinks? So they gave people 4 of the small cans of Red Bull, or 4 cups of coffee, same amount of caffeine, and then measured their blood pressure over the entire day. Same amount of caffeine, yet significantly higher average blood pressure by about 5 points over the coffee. So maybe it's the taurine or some other combination of added ingredients in the energy drinks that makes them so harmful. Energy drinks may also impair artery function. 1 big can of Monster Energy drink and a significant drop in your artery's ability to relax normally within 90 minutes. The biggest risk, though, is likely the EKG changes that signal an increase in the risk of our hearts flipping into a fatal heart rhythm. And indeed, there are cases of young people suffering cardiac arrest after consuming like 7 or 8 cans in a row, or even just 3 cans back-to-back. Some people are just more susceptible. Yeah, there are a number of case reports highlighting multiple potentially fatal cardiac side effects from high-energy drinks in the general population, but it's the families with a history of sudden cardiac death or fainting that education about the risks are even more critical, as energy drinks may unmask a potentially life-threatening genetic condition such as LQTS, a long QT syndrome, which occurs in about 1 in 2,000 people. Yes, there are safety issues, but do the benefits outweigh the risks? Unfortunately, little evidence exists to support any beneficial effects. What about for athletes, though? I mean, that's who energy drinks were originally marketed for, and boy did that marketing work, with 80% of college athletes reportedly drinking them. So does it help? You don't know until you put it to the test. And as you can see by the title, pre-exercise energy drink consumption does not appear to improve endurance, but it does seem to increase inflammation. 25-mile simulated road race, and they could not find any ergogenic potential, any athletic performance-enhancing potential of Red Bull above that of just straight sugar water and caffeine. In addition, the data indicate that Red Bull induced greater inflammatory-related responses than did just straight caffeinated sugar water or placebo. No apparent effect in resistance training either, not just endurance sports. And those hoping energy drinks will help rev up their metabolism to lose weight may be disappointed to learn you can get the same stimulatory effects with straight caffeine, or maybe they won't be disappointed. Black coffee or tea is way cheaper. No wonder there was no change in athletic performance, because unlike nitrate-rich vegetables, energy drinks don't change oxygen utilization or ratings of perceived exertion. But what they do is raise your resting blood pressure, so the opposite of vegetables like beets and greens, which both improve athletic performance and reduce blood pressure at the same time, whereas energy drinks appear to have no therapeutic benefit. Dyspepsia is the medical term for upset stomach. After eating, your stomach may hurt, or you feel bloated, nauseous, overly full, belching. Despite the high prevalence of the disorder, there are no approved treatments for it in the Western world. This leads people to seek out alternatives like baking soda, which the manufacturer promotes for use for upset stomach. The problem is that it contains sodium bicarbonate, and therefore has the potential for significant toxicity when ingested in excessive amounts, potentially resulting in serious electrolyte and acid-base imbalances. The labels were modified in 1990 to include the warning, "Do not administer to children under age 5," because of reports of seizures and respiratory depression. Even just a pinch may be too much for an infant, and even just a few large spoonfuls could be fatal in a child. Another new addition is the stomach warning, stressing the importance of not taking the product when overly full with food or drink. Why not? Well, if you're familiar with Scholastic Science Fair volcanoes, right, they're baking soda and vinegar, right? Baking soda and acid, like what's in your stomach. This warning was added at the request of the FDA because of multiple case reports of spontaneous gastric rupture, where people's stomachs burst. But exploding stomachs aside, even just sticking to the suggested dose may still cause adverse effects, so baking soda cannot be recommended, especially in young children, pregnant women, alcoholics, and those who are on diuretics, a common blood pressure medication sometimes referred to as water pills. What about acid-blocking drugs like Nexium or Prilosec? They work better than sugar pills, but not by much, helping 31% of dyspepsia sufferers compared to 26% helped by placebo. In other words, 5% better than nothing. These so-called proton pump inhibitors have been extremely lucrative for the pharmaceutical industry, raking in billions a year. But now that we have these massive computerized databases of patients, we can start to evaluate some of their possible long-term adverse effects. For example, possible increased pneumonia, bone fractures, intestinal infections, heart disease, kidney failure, and even all-cause mortality. The latest concern to surface has been the association between the use of these drugs and the risk of dementia. The problem with all these studies just showing associations, though, is that you can't prove cause and effect. Maybe taking the drugs didn't make people sick. Maybe being sick made people take the drugs, right? So maybe it's not that these drugs are the cause of these infections, fractures, death, and dementia. It's just that they may instead be a marker for being sicker. But there are potential mechanisms by which drugs could have some of these effects. For example, here's the death data. The longer people are exposed to these drugs, the higher their apparent risk of dying prematurely. But how could suppressing acid production in the stomach increase mortality, which is mostly like heart disease? Well, suppressing acid isn't the only thing these drugs do. They may also cause a reduction in nitric oxide synthase, the enzyme that makes the open sesame molecule that helps keep our arteries healthy. In terms of dementia, a key event in the development of Alzheimer's disease is the accumulation of these plaques of a sticky protein called amyloid beta. And if you just stick Alzheimer's-like cells in a petri dish and drip on increasing levels of the drug Prevacid, the cells start churning out more amyloid. And the same thing with Prilosec or Losec, or Protonix, and Nexium. Now, just because something happens in a petri dish or a mouse model doesn't mean it happens in a person. But most studies to date have found this link between dementia risk with the use of these drugs, including the largest such study to date, involving tens of thousands of patients, that conclude that avoiding the chronic use of these drugs may help prevent the development of dementia. Though an alternative explanation of the link is aluminum exposure, which itself may play a role in dementia. And so maybe those using acid-blocking drugs have heartburn or something, and so are also using more aluminum-containing antacids, and that's actually the real culprit. We still don't know. What we do know is that there's an almost cultish faith in stomach acid suppression as some kind of medical panacea, which has led to a progressive escalation of dosage and potency of these drugs. All the while, mounting evidence suggests these drugs may cause a variety of adverse effects and are overprescribed. How overprescribed? The rate of inappropriate use of these drugs is about half. Half the people on the drugs shouldn't even be on them. These rates are worrying because they mean that these drugs are prescribed for things they shouldn't even be prescribed for, meaning there aren't even proven benefits to outweigh the risks. Dyspepsia is just a fancy word for an upset stomach. Feelings of fullness, discomfort, nausea, bloating, belching, affecting up to 1 in 5 individuals. In my last video, I talked about the risks associated with proton pump inhibitor drugs like Nexium, as well as folk remedies like baking soda. So all in all, studies have emphasized the unmet need for medications to treat patients with dyspepsia, but why not try food? One study put amalaki to the test, which is just another name for amla. They call it an Ayurvedic drug, but it's just a fruit, powdered Indian gooseberries. 1 teaspoon of dried Indian gooseberry powder 3 times a day, versus an ounce of some gel and acid every 3 hours. And both work just as well. Significant decreases in peak acid output, and a cutting of dyspepsia symptom scores in half. They conclude that amla is therefore better, it's about 100 times cheaper, about a penny a week instead of $1 a week, and more convenient than downing antacids 6 times a day. Though amla may be a safe, simple, natural remedy, such an approach is still very much in the pharmaceutical model of treating the symptoms rather than the underlying cause. Dyspepsia is not caused by a gooseberry deficiency. What is it caused by? Well, about 1 in 7 people describing a range of gastrointestinal symptoms feel better cutting out gluten. But for the other 86% of people, the most well-characterized trigger is high-fat meals. If you give people a fatty soup, just broth with added fat, it takes 3 times longer to empty from your stomach compared to the broth alone, like an hour and a half versus just a half hour. Now, the emptying rate didn't necessarily correlate with how people felt, but regardless, the fatty broth increased the severity and frequency of dyspepsia over the regular broth. What happens in dyspepsia is people become hypersensitive to the stretching of the stomach when you eat, but it also matters what you eat. The human stomach can normally accommodate about a quart of food, 1,000 milliliters, 4 cups. But if you stick a balloon into people's stomachs attached to a hose, people with dyspepsia will start feeling discomfort about here, only about 1.5 cups, when the stomach is less than half full. But that's when you're dripping fat into their gut. But if you're instead dripping sugar into their gut while you're blowing up the balloon, it can get up to here before causing discomfort in dyspeptics, about 70% more. And the same with fullness and nausea. Increase the pressure in the stomach with fat in there, and fullness and nausea shoot up. With fake fat in your stomach instead, the same pressures result in significantly less feelings of fullness and nausea. These studies show that during distension of the stomach, as the stomach fills up, dietary fats are a major trigger of dyspeptic symptoms such as nausea, pain, bloating, fullness, and they modulate symptoms in a dose-related fashion, meaning more fat, the worse people felt. These were some pretty elegant experiments, but also a bit artificial. I mean, we don't typically eat with balloons in our stomach, so how about an experiment using actual food? They compared yogurts high in sugar, low in fat, versus high in fat, low in sugar. Eating the low-fat yogurt, there wasn't much of a difference in the nausea, pain, and bloating scores between those with dyspepsia and healthy subjects, but give them the same amount of high-fat yogurt, and dyspepsia symptoms shot up almost immediately. So one of our major findings was that the induction of gastrointestinal symptoms after the test meals were nutrient-specific. The consumption of a high-fat test meal was associated with a substantially greater increase in nausea and pain when compared to a high-carbohydrate meal among those with dyspepsia, with the symptom scores increasing immediately after eating. This would suggest that sufferers not only reduce the amount of food they eat, which is the typical advice, but also try to keep the fat content down, a message echoed by a recent review of all such studies put together. Current studies show that fatty foods are associated with occurrence of dyspeptic symptoms, and reduction of fat intake may help alleviate symptoms. Acne remains one of the commonest diseases to afflict humanity. If you do online surveys, tea tree oil appears to be the second most commonly used topical treatment after benzoyl peroxide. Though crowdsourcing may be a novel research method for evaluation of acne treatments, before getting too enamored with popular wisdom, you should know that there's stuff like this circulating on the internet: the facial application of urine as a home remedy for acne. Urine therapy advocates cite historical use as proof of its therapeutic potential as a free cure for many systemic diseases, apparently forgetting all the god-awful crazy skeletons crowding the closets of medical history. While recycling what the body intentionally removes may seem counterintuitive to good health, what about Premarin? The best argument this author could come up with for putting urine on your face is, hey, women, after all, swallow pills made from pregnant horse pee. Not exactly following the logic there. Of course, there's drugs for acne. There's always drugs, though along with drugs comes drug side effects. Antibiotics that suppress the bacteria that cause acne are the standard treatment for acne, but are becoming less effective, presumably because of the emergence of antibiotic-resistant strains. The prevalence of resistant strains has apparently grown rapidly, such that antibiotics for acne are no longer recommended just by themselves, with reevaluations advised every 6 to 8 weeks. Well, the bacteria do seem to be susceptible to tea tree oil in a petri dish, but these kinds of studies were performed with free-floating bacteria, whereas in pimples, the bacteria form what's called a biofilm, which makes them generally more difficult to eradicate. The bacteria forms like glue that plugs up the follicle, so petri dish studies can only tell you so much. I mean, even if tea tree oil couldn't kill off the bugs, though, it has been shown to suppress skin inflammation. Like if you inflame people's skin with an allergen and then try to calm it down, tea tree oil did a decent job compared to an over-the-counter ointment or a moderate-potency prescription steroid cream. So potentially, tea tree oil could help with acne via an antibacterial mechanism or from an anti-inflammatory standpoint, but you don't know until you put it to the test. A 20% tea tree oil gel applied twice a day, and a beautiful drop in acne lesions after 1, 2, 3 months, about 24 pimples down to about 11. They conclude that the study showed that tea tree oil could significantly improve mild to moderate acne. But who can tell me the study's fatal flaw? Right, there was no control group. how do we know they wouldn't have healed even faster without it? In this systematic review of randomized clinical trials on tea tree oil, their most striking finding is that they could hardly find any. Given the widespread use of tea tree oil, this is both disappointing and important to note. But finally, a randomized, double-blind, placebo-controlled trial of a 5% topical tea tree oil gel in mild to moderate acne. After 6 weeks in the tea tree oil group, a 40% drop in whiteheads and blackheads, a 40% drop in red and tender acne bumps, and a 47% drop in pus-filled pimples, compared to comparatively little change in the control group. Overall, in terms of total lesion count, the tea tree oil gel was 3.5 times more effective than placebo, 3.5 times more effective than essentially doing nothing. But most teens don't do nothing for their pimples. How does tea tree oil compare to the gold standard, benzoyl peroxide? We'll find out right now. Benzoyl peroxide is by far the most popular over-the-counter acne therapy, despite its side effects. It can be irritating, causing redness, dryness, peeling, stinging, burning. However, the prescription option, the long-term use of topical or oral antibiotics, is discouraged due to the development and spread of antibiotic resistance. As a result, attention has turned to non-antibiotic products such as tea tree oil. The benzoyl peroxide did cause more side effects, dryness, itching, stinging, redness, burning, but it worked better too, cutting the number of inflamed pimples by 2/3 within 3 months, versus only by half in the tea tree oil group, though the most recent study found them to be more comparable. Putting all the studies together, and tea tree oil products not only beat out placebo, but approximate more standard regimens like benzoyl peroxide or topical antibiotics, suggesting tea tree oil products may be an appropriate option for treating mild to moderate acne. In my video on henna, I talked about the study that proved lead could be absorbed through skin and into the body. Researchers applied lead to someone's left arm, and then they measured the level of lead in the sweat coming off their right arm over the next few days. There was a big spike proving that lead can go into your body, but also proving that lead can go out of your body. If we can lose lead through sweat, how about using sweating for detoxification? Look, no person is without some level of toxic heavy metals in their blood circulating and accumulating, and hey, cultures around the world have viewed sweating as health-promoting, from Roman and Turkish baths to sweat lodges and saunas. But what does the science say? When I looked up saunas, I was surprised to see this, a study on the detoxification of 9/11 rescue workers, with a regimen of exercise, sauna bathing, and supplements. They reported on 7 individuals, and evidently during the month before the treatment, PCB levels in their blood stayed about the same. In contrast, all rescue workers had measurable decreases in their PCBs following treatment, and they reportedly felt better too. They had all sorts of symptoms, respiratory, neurological, musculoskeletal, but felt better after the treatment. Improvements consistent with nearly 400 others they treated with the same protocol. Wait a second, if they treated 400, why are they only reporting the results from 7? That's a bit of a red flag, but not as red as this. The detoxification regimen was developed by Hubbard, as in L.R. Hubbard, L. Ron Hubbard, the founder of the infamous Church of Scientology. And the lead author of the detoxification paper also appears to have failed to disclose his financial conflict of interest for presumably profiting off the treatments. Sweating does, however, represent a time-honored treatment in the field of medicine for mercury poisoning going back centuries, but time-honored medical treatments include drilling people's skulls open to release evil spirits, or even giving people mercury itself. Remember mercurochrome? What do you think the mercuro stood for? In fact, some believe Mozart died of mercury poisoning trying to cure his syphilis, though of course all the bloodletting he got probably didn't help either. Another time-honored medical treatment that makes Scientology saunas look pretty mild in comparison. But a case report was described of a person who had apparently recovered from mercury poisoning after 6 months of sweats and physical therapy, but maybe he would have gotten better anyway. You don't know until you put it to the test. Mercury wasn't formally studied, but lead was. Put people in a 200-degree dry sauna for 15 minutes, and based on sweating rates, those 15 minutes in the sauna would force out about 40 micrograms of lead from the body. with some people getting rid of 100 or more per session. So you could drink like a gallon of chicken broth, and even if you absorbed all the lead, you could be back to baseline after just one sauna session, even after drinking bone broth. Is it safe for children? Based on what we know now, sauna bathing poses no risks to healthy folks throughout the life cycle, though medical supervision couldn't hurt. Now, this doesn't mean it would be as effective in children, as adults sweat a lot more than kids, and of course kids are the ones who need lead detoxing the most. There's a clear need for robust clinical trials to test all this, but even if it works, it's not like some poor kid in Flint's going to have access to a sauna. That's why I was so excited to find this paper, The Change in Blood Lead Levels of Basketball Players After Strenuous Exercise. Saunas aren't the only way to sweat. What about strenuous physical activity? Evidently, there was a study that found aerobic endurance training led to a drop in lead levels, with rowing better than cycling. But for how long, how intense, I don't know. I don't read German. Verzeihung. But I did find the study, and it looks like they ramped up the stationary bike 50 watts every 2 minutes until exhaustion, so probably just a few minutes with no significant before or after difference in blood or urine lead levels, whereas an hour-long endurance exercise row did seem to drop lead levels about 12%. This one I can read, though. A single intense training session on the court, and college basketball players' blood levels dropped down to— wait a second, they went up? A significant increase in blood levels? In fact, by nearly 300%. They suspect it's because where they were playing was so contaminated. This study was done in Turkey, where the lead levels in the air are evidently so high that all that extra breathing evidently made things worse, which I think underscores an important point. All the dietary tweaks I've talked about for lead poisoning and sweating it out could be thought of as more expedient and cost less than primary prevention, getting at the root cause. This, however, represents a retreat of sorts from a commitment to cleaning up the environment and getting rid of these hazardous pollutants in the first place. Lifestyle interventions should only be thought of as temporary solutions, and continued emphasis must be placed on eliminating lead in children's environments in the first place. When you read articles like this in Alzheimer's disease journals about how eating more berries may reduce cognitive decline in the elderly, they're talking about observational studies like this, where berry intake appeared to delay cognitive aging by up to 2.5 years in the Harvard Nurses' Health Study, or the intake of nuts, appearing to delay brain aging by 2 years. They're just talking about associations, meaning berry eaters and nut eaters tend to have better brain function as they age after trying to control for a bunch of other lifestyle factors. But you don't know if it's cause and effect until you put it to the test. Thankfully, we now have a growing number of interventional studies that have done just that, randomized, controlled trials where people eat berries or nuts, and you can prove it, actually show improvements in cognitive performance, raising the berry-nutty idea that we may be able to forestall or reverse the effects of neurodegeneration in aging with food. For example, this study on the effects of walnut consumption on cognitive performance. College students split up into groups, doing 2 months of walnuts, followed by 2 months of placebo, or vice versa, and then they switch. How do you make a placebo nut? Well, they baked it in. They gave people banana bread, with or without nuts. Same ingredients, just one with walnuts. And those on nuts showed a significant improvement in inference capacity, the ability to accurately draw conclusions from a set of facts. In other words, kind of critical thinking. And so on a practical level, maybe students or young professionals in fields that involve a great deal of critical thinking or decision-making could possibly benefit and gain a slight advantage through regular consumption of walnuts. Or this berry study, where they randomized folks to some crazy berry smoothie with blueberries, black currants, elderberries, lingonberries, strawberries, and a tomato. And not only did their bad cholesterol drop about 10 points, they performed better on short-term memory tests. So good for the heart, good for the brain. And not just better on like pencil and paper tests, but real-world applications. Give people Concord grape juice versus some fake grape Kool-Aid type placebo, and you can get improved performance on like everyday tasks, like quicker response times in driving tests. Why not just give people Concord grapes instead of juice? Well, then it's harder to create a placebo, And of course, the study was paid for by Welch's. OK, fruit and nuts. What about vegetables? Consumers of cruciferous vegetables like cabbage, cauliflower, kale, collards, broccoli, and Brussels sprouts have been found to perform better in several cognitive tests than non-users. In terms of cognitive decline with aging, women consuming the most green leafies did better, effectively slowing brain aging a year or two, and not just cruciferous, but other dark green leafies like spinach. So maybe it's the nitrates. As we age, our cerebral blood flow drops, the amount of blood flowing through our brain, which may be due to an age-related decrease in the production of nitric oxide, the open sesame molecule that dilates our blood vessels and is boosted by the consumption of nitrate-rich vegetables. This reduction in blood flow to the brain may be a major risk factor for the impairment of cognitive function and the development of neurodegenerative diseases such as dementia. We know nitrate-rich vegetables like leafy greens and beets can improve physiological performance, like beet juice does for athletes. But what about cognitive performance? The production in our brain of nitric oxide, the open sesame molecule that dilates our blood vessels and is boosted by the consumption of nitrate-rich vegetables, and the role of nitric oxide in the control of nerve functioning has been comprehensively investigated in lab animals. However, little evidence on its role in human brain function existed until it was put to the test. Feed people lots of green leafy vegetables with some beet juice to boot, and then measure cerebral blood flow. See that spot there with improved flow? That's a critical brain area known to be involved in executive functioning. OK, but improved blood flow doesn't necessarily translate into improved cognitive function. For example, feed people tart cherries, and despite some indication of improved blood flow, this didn't appear to manifest as improved cognitive performance. And indeed, some of the initial studies were disappointing. Give people over a cup of cooked spinach, and no immediate boost in the ability to carry out simple tasks. But that may be because the tests weren't hard enough. Give people a similar battery of simple tasks after consuming cocoa, and no significant effects. But put people through a more demanding set of tasks, and you can see acute improvements in cognitive performance after cocoa consumption. The tasks they're talking about is like counting backwards in threes for minutes at a time. What if you tried doing that same thing after drinking 2 cups of organic beet juice, which has about the same amount of nitrate as 2 cups of cooked arugula? Significant improved performance in terms of more correct answers on the sustained subtraction task. These results suggest that a single dose of nitrate-rich vegetables can modify brain function, and that this is likely to be as a result of increased nitric oxide synthesis. OK, but how do we know it's the nitrate? Beets are packed with all sorts of phytonutrients like the betalain red pigment. One way to tease it out would be to come up with some kind of nitrate-depleted beet juice. Has all the other stuff in beets, but just missing the nitrate, to see if that works just as well. And that's exactly what researchers did. They developed a nitrate-depleted beetroot juice placebo. And compared to that, within 2 weeks of supplementation with the real stuff, this group of diabetics got a significant improvement in reaction time. Now we're just talking 13 milliseconds here, but other interventions like balance training that only increased reaction time like 7 milliseconds were associated with significantly lower fall risk. And of course, in athletes, those fractions of a second can sometimes make a difference. At very high exercise intensities, cognitive task performance deteriorates, with a pronounced detrimental effect on reaction time. And that may be just when you need it the most, like you're playing football or something and need to make rapid, appropriate decisions while simultaneously going all out. And once again, beets to the rescue, significantly reducing reaction time. It's not only improving physical performance, but mental performance as well. Yeah, but can it improve the structure of your brain? Things like cognitive training and aerobic exercise can actually affect the structure of the human brain. There's something called neuroplasticity, where your brain can adapt, changing its configuration as you learn to play piano or something. We used to think only younger brains could do this, but now we know it can occur in the aging brain as well. Can't beat that, or can you? We didn't know until now. Here's your brain, before and after a 6-week exercise program measuring connectivity between various parts of your brain that control movement. No big change, but what about the same amount of exercise before and after drinking some beet juice too? Big difference. The exercise plus beetroot juice group developed brain networks that more closely resembled those of younger adults, showing the potential enhanced neuroplasticity conferred by combining exercise and nitrate-rich vegetables. In a series of videos I did about saturated fat, I talked about a major campaign launched by the global dairy industry to neutralize the negative image of milk fat among regulators and health professionals as related to heart disease. That campaign continues to this day, with the publication of a meta-analysis demonstrating neutral, meaning non-harmful, associations between dairy products and cardiovascular disease and death. OK, well, first of all, how do we know the dairy industry had anything to do with this study? Well, it was published in a journal that forces authors to disclose financial conflicts of interest. Let's see what they divulged. Dairy, 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 the fourth largest dairy company in the world, dairy, dairy, milk, beer, soda, McDonald's, dairy, 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 dairy. Oh, and the study itself was explicitly funded by dairy, dairy, dairy. OK, then. The other big new one was this, suggesting that a little bit of cheese every day isn't just neutral, but actually good for you. And they make it clear that they have no conflicts of interest. They're just employees of the Yili Innovation Center and the Yili R&D Center. You know, China's largest dairy producer, making it one of the world's largest dairy companies. OK, but how can cheese consumption be associated with better health outcomes? Well, most of these studies were from Europe, where cheese consumption is associated with a higher socioeconomic status. See, in Europe, they're not eating Cheez Whiz and Velveeta. Cheese is generally an expensive product, and so who eats cheese? Those with higher-paying jobs, higher socioeconomic strata, higher education levels, all of which are associated with better health outcomes, which may have nothing to do with their cheese consumption. Higher socioeconomic groups also consume more fruits and vegetables, and more candies. So I bet you could do a population study and show candy consumption is associated with better health. Shh, don't tell the National Confectioners Association. Too late. Did you know that candy consumers have lower levels of inflammation? A 14% decreased risk of elevated blood pressure brought to you by the candy industry and the USDA, our government, which props up the sugar industry to the tune of $1 billion a year. It's like when our tax dollars are used to buy up surplus cheese. Paul Shapiro wrote a great editorial. Imagine the headline, "Government buys $20 million in surplus Pepsi," or hard-earned tax dollars buying up millions of unwanted cola cans, all as a favor to the flailing soda industry, which just kept producing drinks no one wanted. As outrageous as such a government handout to the soda industry would be, that's exactly what the USDA is doing for the dairy industry. Michelle Simon did a great report on how her government colludes with the industry to promote dairy junk foods. The federal government administers checkoff programs to promote milk and dairy. McDonald's has 6 dedicated dairy checkoff program employees at its corporate headquarters to try to squeeze in more cheese. That's how we got double steak quesadillas. That's how we got 3 cheese stuffed crust pizza complete with a summer of cheese. These funds are being used to promote foods that contribute to the very diseases our federal government is allegedly trying to prevent. Does it make sense to tell Americans to avoid foods high in salt, sugar, and saturated fat while engaging in the promotion of those same foods? Look, the meat and dairy industries can do what they like with their own money, but the public power of taxation should be used for the public good, not to support the dairy and candy industries. When industry-funded studies suggest their products have neutral health effects, or even beneficial, one question you always have to ask is, compared to what? Is cheese healthy? Compared to what? And if you're sitting down to make a sandwich, cheese is probably healthy compared to bologna, but compared to peanut butter? No way. That's the point Walt Willett made, a former chair of nutrition at Harvard. To conclude that dairy foods are neutral could be misleading, as it could be misinterpreted to mean that increasing consumption of dairy foods would have no effects on cardiovascular disease or mortality. Lost is that the health effects of increasing or decreasing consumption of dairy foods would depend, importantly, on the specific foods that are substituted for dairy foods. Like, what are you going to put on your salad? Cheese would be healthy compared to bacon, but not compared to nuts. See, consumption of nuts or plant protein has been found to be protectively associated with the risk of coronary heart disease and type 2 diabetes. In contrast, intake of red meat, for example, has been associated with increased risk. Thus, it's reasonable to assume that the lack of association with dairy foods could put them somewhere in the middle of a spectrum of healthfulness, but certainly not an optimal source of energy or protein. More broadly, the available evidence supports policies that limit dairy production and encourages production of healthier sources of proteins and fats. He wasn't just speculating. This was based on 3 famous Harvard studies involving hundreds of thousands of men and women, exceeding 5 million person-years of follow-up. This was really the first large-scale prospective study to examine dairy fat intake compared to other types of fat in relation to heart attack and stroke risk. So replacing like 100 calories of fat worth of cheese with 100 calories of fat worth of peanut butter on a daily basis might reduce risk up to 24%, whereas substitution with other animal fats might make things worse. Here's how it breaks down for heart disease. Swapping dairy fat for like vegetable oil would be associated with a decrease in disease risk, whereas swapping dairy for meat increases risk. Dairy fat calories may be as bad or worse as straight sugar. The lowest risk would entail swapping to a whole plant food like whole grains. Yeah, dairy products are a major contributor to the saturated fat in the diet, and have thus been targeted as one of the main dietary causes of, the #1 killer of men and women. But the dairy industry likes to argue there are other things in dairy products, like fermentation byproducts and cheese, that could counteract these saturated fat effects, all part of an explicit campaign by the dairy industry to neutralize the negative image of milk fat among regulators and health professionals. If Global Dairy Platform looks familiar, they were one of the funders of the Milk and Dairy is Neutral study, trotting out their dairy fat is counteracted notion. To which the American Heart Association responds that no information from controlled studies supports the assertion that fermentation adds beneficial nutrients to cheese that somehow counteract the harmful effects of the saturated fat. We need to cut down on dairy, meat, coconut oil, no matter what their respective industries say. In fact, that's the reason the American Heart Association felt they needed to release this special presidential advisory in 2017. They wanted to set the record straight on why well-conducted scientific research overwhelmingly supports limiting saturated fat in the diet. Observational studies like these, suggesting dairy might not be so bad, can be confounded by extraneous factors, such as the fact that people who eat more cheese tend to be of higher socioeconomic class. Fine, but what about this interventional study, a randomized crossover trial which compared a high-fat cheese diet to a high-fat meat diet to a low-fat diet, a high cheese diet, cheese, which is loaded with saturated fat, a high meat diet, meat, which is loaded with saturated fat, versus carb, a low-fat diet, and people ended up with the same cholesterol levels. Let's see how they did it. Half the study was paid for in part by the dairy industry, and the other half paid for by dairy. If you're the dairy industry, and you're trying to design a study to show that a high cheese diet doesn't raise cholesterol, how would you go about doing that? Anyone remember this video? It's one of my favorites. The beef industry was in the same pickle as the cheese industry. Beef has saturated fat, which raises cholesterol, which raises the risk of dying from our #1 killer. What's an industry to do? So they designed a study where they added beef, and cholesterols went down. How is that possible? Here's the 2 diets. They added beef, and the cholesterol went down. They did this by cutting out so much dairy, pork, poultry, fish, and eggs that their overall saturated fat intake was cut in half. They cut saturated fat levels in half,
and the cholesterol levels went down. Well, duh. They could have swapped in Twinkies and said snack cakes lower your cholesterol, or frosting, or anything. OK, so now that you know the trick, let's go back to this study. The way to get the same cholesterol levels is to make sure all 3 diets have the same amount of saturated fat. Now, how are you going to do that? How are you going to get a high-fat cheese diet and a high-fat meat diet to have the same saturated fat as a diet with neither? Unless— wait, don't tell me. Wait, they added coconut oil or something to the other diet? They added so much coconut oil and cookies to the so-called low-fat diet that they all had the same amount of saturated fat, and voila! That's how you make a cheese or meat-rich diet that doesn't raise cholesterol. That reminds me of the desperation evident in this study that compared the effects of dairy cheddar cheese to a non-dairy cheddar cheese called Daiya. Milk consumption has plummeted in recent years as people have discovered plant-based alternatives like soy milk and almond milk, and now there's plant-based cheese alternatives. What's the National Dairy Council to do? How are you going to design a study that shows it's healthier to eat cheese? Design a study where cheese causes less inflammation than the vegan alternative. They got their work cut out for them. Daiya is no health food by any stretch, but definitely 3 times less saturated fat than cow cheese. So I give up. How could you possibly show more inflammation from Daiya? Well, there is one fat that may cause more inflammation than milk-fat palm oil. In fact, it may raise cholesterol levels as much as trans fat-laden, partially hydrogenated oil. Yeah, but what, are you telling me they slipped the Daiya group some extra palm oil on the side? Yes! Can you believe it? They compared cheese to Daiya plus palm oil. So much extra palm oil that the vegan alternative meal ended up having the same amount of saturated fat as the cheese meal. That's like proving tofu is worse than beef by doing a study where they compared a beef burger to a tofu patty stuffed with lard. Oh wait, the meat industry already did that. But at least they had the decency to concede that replacement of meat by tofu in the habitual diet would probably not usually be accompanied by the addition of lard.